Alrighty, so I'm here to demonstrate some of the things that we've been learning for cardiopulm. The first thing that we talked about was the cervical extension postural correction, which would be someone who has like the rounded or forward head posture. So we're going to inhale as we go back with our neck and then exhale as we come forward. Then scapular retraction, we're going to be inhaling as we pull back, kind of like a row here, pinching the shoulder blades back together. Inhale with that, exhale as we come forward, and then similar inhale with the shoulders. Supine, this is going to be my pillow roll. You're going to be positioning it on the bed or table or whatever. You're going to be positioning it between the scapula, and that will help open up the chest cavity here as it creates some like rounding, similar with side lying. If you're laying on your side this way, it's going to cause opening and spreading of the chest wall of the opposite side that you're not lying on. The myofascial manual technique, for soft tissue release, you're going to be spreading. If there's a restriction that you're noting in the skin and in the myofascia on the side, you're going to be spreading that and holding it. And then mobilizing the ribs, you can do some like bouncing of the rib cage. Diagonal lifting PNF pattern, that's going to be lifting, inhaling and exhaling during that motion. Some positional enhancements that we talked about were lying prone on your elbows, which is again creating some thoracic extension, going to be opening up the chest cavity there. So patient is lying prone, kind of propping up on their elbows. Yeah, and then standing or sitting, you can use that tripod position to kind of help the accessory muscles to allow for better breathing. The butterfly technique is going to be hands here, so you're going to inhale with the arms back, exhale as you come forward. The lower costal breathing, that would just be again lying supine, and you're going to kind of progress from them learning how to use the musculature in the lower costal area. So some ways that you could do that would be supine breathing with like a Kleenex box in their stomach so that they can see that visual cue of stomach going in and out and the rise and lowering of the Kleenex box. And then you're going to progress to performing that in sitting, then standing, and then with physical activity, so they're learning how to control that during functional activities. Pursed lip breathing, that's going to slow the respiration rates. So kind of blowing through lips that are together, that helps slow the respiration rate for them. And then exhaling with effort is a way to practice. Particularly like exhale activities are going to be with COPD patients. And then paced breathing, I'll just kind of talk through that rather than demonstrate it, but that would be, you're going to do like 2 steps. So that would be like with stairs or just with walking. You're going to inhale for 2 steps or 2 paces, and then exhale for 4 paces or 4 steps. So you're kind of doubling the exhalation time to the inhalation time. Moving to the coughing. So the components of a normal cough would be the like inhale. So you're like exhaling forcefully. Huff coughing would be that trying to get the air coming out at a volume that it's going to be moving that tissue so that they can practice and have the visual cue for that. Flex positioning, they're going to be rounding up a little bit and then coughing from that position. Splinted coughing, you're going to hold the incision. So this would maybe be with a cabbage patient or something where they have that sternal incision. You're going to be holding that with a pillow or their hands to reduce pain. Also, you can do that for rib fractures. Costophrenic assist, that's going to be if the patient is supine. The therapist puts their hands on the patient and kind of goes up and pushes on like the lower thoracic rib cage. And then the Heimlich, you're kind of dropping in with the Heimlich, and you're pushing up and in with your hands to facilitate that. Similar with the side lying, the hand positioning. And then to combine the Costophrenic and the Heimlich, you have a hand on the chest, hand on the stomach, and doing both. And then counter rotation assist would be coughing with kind of like forcing the patient into the counter rotation. Self cough assist, you're going to be prone on the elbows. So that would just be patient lying prone, coughing in that position. Tetra long sitting would be, I believe, sorry, let me check on this. Oh, and also, sorry, so you're going to breathe in and then cough, coming forwards. So that's in those different positions. It's going to be prone, leaning back, cough, long sit, leaning back, cough, short sit. You're going to do the same thing, just in a short sitting position. And then counter rotation with the cough is going to be like kind of coming up and then in. And then the other thing I missed, breath stacking. Sorry, having trouble remembering exactly what that one is. Oh, so that's just breathing in. So you're breathing in consecutive breaths without letting it out, and then you cough it all out simultaneously. So that I think about covers the lab techniques that we were practicing. Yep, thanks.